Hi, everyone. 1 second. Okay. So we're really excited to be here. And I'm Lisa.
I'm Brenda.
Okay. Today we are launching, actually we kind of launched last week, but we're launching the first real full month's episode of Thriving Thursdays. And we decided to focus on the fundamentals to start, which is the spine. So we're going to be really focused on a healthy spine and how do we keep our spinal health? How do we keep the natural curvature of our spine in place? I love so that we don't create compression. And as we're going to find today, that compression and those imbalances in the spine will actually create a lot of havoc. But before we dive in, Brenda, what do you want to let people know?
Okay, we have a couple disclaimers to make before we get started today. So first of all, I want you to know that these lives are for educational purposes only. They are not a substitute for yoga therapy or for a medical evaluation. So just be sure of that. If you do want to schedule a yoga therapy session with us, please DM us down below and we will get back with you for that.
Yeah. And so we'll be doing a high level thing on the spine this month. This session, we're going to focus on some of the issues and stuff that can show up when our spine is out of balance. And then in our next issue, which will be on the 18th of February, we'll be getting into some of the different interventions or remedies someone can start to integrate in to bring back that balance right into the spine. So
first, our curves.
Oh yeah, the curves. That's where we're going to start. Okay, so our spine has a natural curve. And what we'll find is that over time, whether it's something that might have happened to us, like an injury, or sometimes it's just practices, daily practices, like just the obvious that most of us are aware of, right? Hi, Steven, is when we're all looking down at our phones, we're all on computers, and we start to do this. Now, when we do this, can we see how that natural curve of the spine gets lost? So we're going to actually dive into all those details, but let me introduce you to your spine if you're not familiar. This back part of the neck, this is called your cervical, the cervical part of your spine. As we move down to the back of the heart, this is the thoracic part of your spine. And the reason why I'm going through this is because as we go through the dysfunctions today, we'll be speaking to these different pieces of your spine. Last but not least, right down here, we have the lumbar part of your spine. And the three of them have a natural relationship and curvature. However, what can happen, some of the big issues that we see over time is something called lordosis. So show us lordosis. And maybe we've seen that cheerleader stick it out kind of thing. Maybe we know people that have this. Maybe we have this. Maybe it's something that we were born with. Maybe it's something that's evolved over time. But when this happens, it can create issues, right? So we're going to be talking about how do we meet those. There's another thing called kyphosis. What is kyphosis, Brenda?
It's when we start to get our forward head carriage and our shoulders start to bend.
Yeah, Hunchback of Notre Dame. And what happens is over time, maybe we've even seen people, right, as they've aged, kind of get stuck with their spine like this. Things can get really calcified, right? So our spine health is really important. I'm sure many of us are aware of that. And the good news is there are things that we can do so we don't end up stuck. Now, of course, yoga is not going to be like this remedy for everything 100%. But with the practices of yoga, we can definitely move towards positive change and that alignment and that balance of the spine. And then the one other issue that can happen over time is we get flattened curves. So the cervical spine can become flattened, the lumbar spine can become flattened. And what we'll find as we go down this journey is that when these things happen, it creates compression. And that compression can really impinge our nerves. So I'm gonna ask Brenda to dive into some of the dysfunctions of the cervical spine now.
Okay, so our cervical spine, it does all have this natural curve. I guess we can show it on Lisa, since I'm speaking now. So it's a natural curve here. So what might happen if it is flattened? So if you push your neck back, because sometimes it's kind of challenging to do, but if you have a flattened spine that's in the cervical area, you may start to feel like tingling down your arms. You might get a lot of headaches. Or well, with both of those, you're going to get nerve compression. Because just imagine if your neck is straight, then it's going to compress everything between your head,
I literally
neck,
felt
shoulders,
it all the way down.
You could feel it.
I feel like,
oh, doesn't feel right. Doesn't feel
just
natural. So don't try that at home. Okay, the next one is our lordotic cervical spine. So that's when her neck is going to be.
Do you want to keep my hair up so I can?
Okay, and it's gonna. Her neck's gonna we have that forward head carriage, and we see this a lot, like Lisa just said, in today's society, from hiding from our own self or from, she said it all, texting and computer work and all that fun stuff. But, and this also is going to give you headaches and shoulder and neck compression. So just imagine if when her head's round and she's bending forward like this, imagine all your muscles in your back here are going to become lengthened, really long. And usually we want long muscles, but if these continue to get long and then the front side here is going to shorten the muscles, they're going to get compressed. And little by little over time, the muscles are going to continue to pull you forward. And then sometimes, have you ever seen people that are like this walking down the street? Can you imagine? You can only look at the sidewalk as you're walking. So we are just going to work this month on finding these natural curves. And again, like Lisa said, it's not going to be like we're not the cure-all for everything, but we can always work towards positive change and get towards the spine you like that feels good without compression, relieving yourself, headaches, shoulder pain, tingling arms.
And one more thing that I just it was so prevalent when we were working with our client the other day. We have an 82-year-old male that we were working with, and we spent an hour just doing some really basic things. We actually posted the video. It's up on my my Instagram page. You can check it out, or on YouTube. And literally the vitality that becomes available when these natural curves are restored and worked with is unbelievable. We could see it we should have almost done it before and after with him.
Yeah, we did one session with him, maybe 45 minutes, and did some just gentle movement and exercise, and he was a changed man afterwards. You could see it in his eyes.
It's almost like the blood just started to become more accessible and aliveness became more prevalent.
It was amazing to watch.
So with that said, you know what I wanted to do? I mean, we talked about wanting to do it is as we go through the content that we're going through today, and as we continue that next time, we wanted to give people, because sometimes people, maybe you relate to this, they hear of yoga therapy and they're like, what is that? What is that? And I remember even, I don't know if you felt this way, but when I started, I was kind of like, well, what is that? And we defined it in our last live. But one of the things that I wanted to talk about that we didn't really speak to in our last live is what are our goals as a yoga therapist? If we're working with somebody and we can see this imbalance in the natural curvature of their spine. The first thing that we're looking to do is invite in stabilization, right? So that there is more energy and prana and vitality able to move and able to flow. The next thing that we might want to do is we might want to release any of that chronic contraction, like we were just talking about here, this contraction that could happen and create a lot of nerve impingement. Then we're looking at how can we strengthen or bring strength into what feels weak.
These muscles, strengthening these so they're not weak and folding forward.
And then we know that for healing to happen, we need circulation. So we're always looking for ways that we can increase circulation for that healing to happen and create more space, because we know that it can really take a toll over a long period of time when that space isn't there and it starts to impinge on the nerves. So just a little space, Brenda.
Just a little space. Any space is good.
makes a huge difference, really. The other thing, in addition to circulation, we want to increase our mobility, right? So as we age, the body calcifies, we lose some of that mobility. So, use it or lose it. Like, we're going to help keep mobility in our range of motion and to hydrate the parts and pieces of us that need that hydration through different yogic practices. And then last but not least, I think this is one of the key things. There's so many key things. But also for physical therapists, they might use this component of a yoga therapy lens, or we might use this component of their lens, however you want to look at it, which is we're looking for the dysfunctional movement. So we're looking for those things that maybe somebody is doing on a day-to-day basis and not even realizing, like this, so that we can invite in movement or practices that are going to move people towards positive change, so that we can replace those dysfunctional movement patterns and identify ones that are functional, and to support people in making that change. Obviously, everybody's making the change on their own, but to really help to expand the awareness to how and why and what can I do about this sensation that is in some cases making me dysfunctional.
Right. And just to always remember too, any movement is good. So we might not be able to go like this, right? Or just anything we do, just move.
Yeah. Even, well, like with Frozen's shoulder,
little movement.
I think we'll get to the shoulder eventually, but just a little is good. Okay, let's come back.
Okay, coming back. So we have nerves. I wish we had our spine here in front of us. One vested, one Monday. But our spine comes down, leaves the spine hair. Well, all your vertebrae come out these little tiny nerves, and they come out right outside of your spine. So it's really important for us to keep space, because if there's no space between those nerves, what's going to happen? What do you think is going to happen? Ouch. So it's going to really compress, and it's going to pinch those nerves. If you've ever had a pinched nerve, you know what that feels like. It is no fun. So when we bring this movement into our bodies, it imbibes our spine. So as we move our spine, it's going to imbibe it with fluid, and we really need this fluid because each vertebrae is a compression joint. So if your vertebrae are stacked on top of each other, right between it, we need fluid. Intervertebral discs.
What does imbibe mean, Brenda?
Imbibe means to bring that fluid into your spine. We need lots of fluid. So movement brings fluid. That's easy to remember, right? Okay, so if you have misalignment in your spine, then it can put pressure on the disc, and there's a few things that'll manifest in. First one is degenerated disc. The second one is bulging disc. So just take notice if you have any of these. And then another one is herniated disc. Thinning discs, and also the disc degeneration with osteophyte. I love that word.
Every time.
Osteophyte.
I struggle too.
And also, like Lisa said also earlier, that we are not going to be able to cure all of your problems. That is for sure. But we're always working towards positive change, and things over time, not overnight, are going to get better, and you will feel better in your body if you do the work.
In fact, it's like, if we think about it, it's kind of like a no-brainer. It's the common sense. Let's all go into the common sense corner. If every day we spend a little more time doing this, then it makes sense that over time we're going to get stuck looking like this. And if every day we just spend a little bit of time doing this,
opening the heart.
Wow. I mean, okay, sorry. Should we go into the next dysfunctions, or
Okay.
did we get into all of those pieces?
I think
for the
we've
disc?
gotten all of those. Just
Yeah.
all of our disc, and we're going to show you next week.
So when our spine's out of alignment, just to kind of hone that into like a big summary, when our spine is out of alignment, you were just talking about the different ways it can manifest, and the thinning disc and so forth and so on. And of course, Common Sense Corner says, yes, yoga would help, right?
To imbibe your disc.
Right. Now,
all right, now
we're going to go back. We're going to come back to something, but it's kind of like the next level of it. So she was talking about how, so we're going into the thoracic part of the spine, and we're talking about some of the dysfunctions that can happen in the thoracic part of your spine. So for example, let's go back to that forward head carriage. So by the way, I will have a post that'll show you how the head, wait, come back, 8 pounds, and then eventually 42 pounds just because it starts to hang forward. And then what happens is this thoracic part of the spine starts to turn into that humpback of Notre Dame, right? Mm-hmm. And it's called kyphosis. Now, outside of the fact that it's simply completely ruining the flow and that natural curvature of your spine, look at what it's doing to her organs. It's compressing her lungs. It's compressing her heart. And it's even compressing some of the organs in her belly, right? So if we start to get stuck like this, it would make sense that it could get like hard to breathe, right? So this kyphosis situation that can happen, I want you to know there's so much that we can do so that we can keep the flow available and keep that natural curvature there, and so that we don't get stuck compressing our vital organs that are giving us our vitality. What's the other one?
The flattened thoracic.
Yeah.
Our bodies are flat.
But I don't know why I'm not remembering what the, okay. So a flattened thoracic spine, you know what it is you wouldn't have movement.
Right,
Because people's thoracic spines can get really like stuck.
Negative effect on our shoulder girdle.
Mm-hmm. Absolutely. And so from here, one of the things that could make it tough is just creating the circulation, right? Because if you're kind of stuck right here, right, you can't imbibe the vertebrae.
And it's gonna
the fluid.
And then our muscles on the side
are gonna get stuck.
Yes.
Right.
Be tension in the side. The muscles that hold our spine up.
Yes. Now,
dysfunctions.
Shall we go into the lumbar?
Yeah. Okay, so the lumbar, we showed you the excessive lordosis. And so it's our lumbar spine, they call it the lordotic curve. Mm-hmm. And so lordosis, cheerleader butt, boop, boop. So this is more risk for osteoarthritis in the lumbar spine.
And it's because, go back into it. Mm-hmm. You see how the weight distribution completely changes when her tailbone is sticking out. So it makes sense that could really create compression, right, in those vertebral joints.
Yeah, and it's that you don't have,
and it's going to be felt here.
Weight balance, so
right,
going to be all off. And then if we have the flattened lumbar curve, so then that would be like no curve at all. I'm going to try to do it. It's a little challenging to do, and it feels a little weird, but it does happen. And so this is also going to affect your weight distribution. We want to be balanced on both legs. We don't want to be going forward or back. We want to be standing nice and tall. It limits our range of motion. So if this is flat, I'm not going to be able to really turn side to side much, right? If you have a curve, it's a lot easier to turn. And let's see what else. Shorten psoas. So we come in the front and it's flat here.
Daddy right there.
And it's going to pull your psoas up, and it's going to be...
What's a psoas, Brenda?
It's a big, giant muscle.
And it wraps.
It wraps all the way around from down here all the way to our low back.
Yes.
To our lumbar spine.
So it's a big... You want a happy psoas. We'll just put it that way.
Your psoas even we're going to go further, it attaches up to your diaphragm as well, and that's going to affect your breathing.
Yes.
So if your back is flat, it's attached to there, it's going to pull, tighten, can't breathe. We're all connected from our head to our toes. It's amazing. Our bodies are quite amazing, but there's lots we can do to help. And the other thing is it'll cause pain in your glutes.
Oh, gosh.
So if this is flat, your glutes are going to be down.
I like the sound effects, right?
I don't know. And then it'll affect your balance. If your
Yeah.
back is flat, how are you going to be able to, like, you know, walk and balance on both feet? That's why our natural curves are in order here. We will get those back if you need to.
It really affects it. So, with that said, we did post the video that was really designed for like spinal health. Mm-hmm. And there's another piece coming. We just haven't gotten it up yet. And that's going to be on balance specifically. And then depending on, anyway, we'll get more into that next week.
standing poses.
We'll get into that next week. I forgot. We're almost going to give you all the other stuff. We're probably out of time anyway. So in summary, I think we just summarized, right? Our curvature is important. It's connected to our balance. It's connected to our vitality. It's connected to our life force energy. And next session, we're going to get into what was naturally starting to happen, which is some of the remedies, some of the interventions, some of the practices. I will post a couple images of the forward head carriage and also all of the manifestations of issues that can happen in our spine in the discs. And with that said, Brenda.
Thank you all for joining us today. It's awesome to see you all on here. And we hope to see you next week. Don't forget, it's on February 18th.
February 18th, 1:11 Pacific Standard Time.